Hi, my name is Dr. Nicola Maher. I'm one of the consultant obstetricians and gynaecologists here at the Rotunda, and I have a special interest in maternal medical conditions and medicine use in pregnancy.
My name is Anu Binu. I work as an Assistant Director of Midwifery and Nursing in the Infection Prevention and Control Department.
During pregnancy, it is recommended that you receive 3 vaccines. One of these vaccines is predominantly for your baby. That is the whooping cough or pertussis vaccine. It is recommended that you receive this ideally between 16 and 34 weeks of gestation. You would receive this at your GP surgery and they will arrange it for you. The second vaccine that we have recommended for many years now in pregnancy is the flu vaccine. This is because women are more at risk of hospitalization from flu during pregnancy. You should receive this as soon as you hear of flu vaccine being available in the community, and this is usually during the winter months from about October until March. Thirdly, we are now strongly recommending that pregnant women receive a COVID vaccine in pregnancy. This is because we are seeing a change in how COVID-19 is behaving in pregnancy, and pregnant women are now at significantly increased risk of hospitalization from COVID and indeed requiring care in ICU. There is also significant risk for your baby if you are hospitalized with COVID, as many of our women who have been very sick have needed to be delivered early and their babies have needed NICU care in order to care for their mums. The COVID-19 vaccine can be received at any gestation, and it is recommended that you receive it as soon as possible. For the COVID-19 vaccine, you can register on the HSC website, or you can attend a COVID vaccination walk-in clinic. In addition, keep an eye on our social media site to see if there are any pop-up vaccination clinics in the Rotunda. It is safe to receive all 3 of these vaccines if you are breastfeeding.
At the moment, we are running a high-risk COVID vaccination clinic in Rotunda in order to cover our high-risk patients like diabetic patients and immunocompromised patients. All other patients has to go through the HSC vaccination clinics for vaccination. And for the flu vaccination, all the pregnant women is advised to go through their GPs. The vaccination during pregnancy is free definitely, but it depends upon your GP to charge you for the administration and the nursing charge for the vaccination program. Today, as we are facing the pandemic all over the world, your journey through the pregnancy in the Rotunda Hospital will be different. Especially as an infection prevention and control, we highly recommend you to adhere to the strict hand hygiene practices and respiratory hygiene practice, and especially when you are in the hospital, we all recommend all of you to maintain adequate social distancing and especially the appropriate and strict adherence of wearing mask when you are indoors in the Rotunda facility. So when you are entering the Rotunda Hospital, we have a front door screeners where you will be able to get surgical face mask after doing the appropriate hand hygiene. I just wanted to show you the appropriate wearing of the hand mask. After doing the appropriate hand hygiene, you have to put the mask covering nose and the face, especially covering your nose appropriately. Try to fix the mask above your nose appropriately so that you will feel a seal around your nose and mouth, and try to breathe in, breathe out, making sure the mask is fit on your face so that it will help you to prevent the spread of COVID-19 in Rotunda. Rotunda is facilitated with hand hygiene gels all around the clinical areas and all the corridors in the Rotunda. So as soon as you enter Rotunda, you will be able to access the hand gel points in Rotunda. Try to use the hand gels appropriately. You have to have at least 20 seconds contact time with the hand gel in order for the hand gel to act appropriately to prevent the COVID spread. In order to promote appropriate hand hygiene, a diagrammatic representation of hand hygiene technique is actually along with all the hand gels in the Rotunda. Try to use one press of alcohol gel and just follow the steps. So in order to make sure you are having at least contact time of 20 seconds, make sure you are doing all your between the fingers and making sure your fingertips are covered. Turn around and making sure you are rubbing against your thumb, inside your hands, and your wrist is very important. Making sure all the alcohol gel is dried off and you have at least 20 seconds of contact time to have an appropriate hand hygiene.